The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives today and into the future. Welcome to the Marty and Laura Show. You guys, I'm excited to announce that today we are going to have the very first of our listener requests. I told you guys we were going to answer questions, and so Marty and I are super excited. We had a very specific listener request. So this comes from a groomer, a gal in Washington State, who had a toy breed dog come to her clinic for a grooming appointment, young puppy, and the dog, while it was there, had a hypoglycemic seizure. And the owner of the dog, of course, was very upset, understandably so. And so this groomer, who's one of our listeners, wanted us to talk everybody through the concept of hypoglycemic seizures, what they are, what can cause them, what else can look like them, right? So that we just have a really good, level set basic information. So, hey, Marty, how you doing?
Hi, good. Good. I think this is a great topic, and it's one that I think clients need to understand, owners need to understand so that they are prepared for this kind of an eventuality should it occur.
Yep, I agree. So, why don't you walk us through the whole concept of what causes a hypoglycemic seizure, and then we can kind of list some of the differentials and some of the different, what type of dogs we might see with this sort of a situation.
Sure. So low blood sugar is hypoglycemia. A lot of people are familiar with it. It's the opposite of diabetes. Diabetes is when your glucose is too high. This is when your glucose is too low, and it's usually below 60, probably more in the 40 and below range, which is pretty significantly low. Too low for your brain to function well. You need to have glucose and oxygen going to your brain, and without those things, then your function is certainly going to be impaired. And there's a number of reasons that low glucose can happen. So we can talk about those. But essentially what happens is it'll look like any other kind of a seizure, and it can be very difficult to differentiate. There can be cardiac seizures, there can be epileptic seizures, there can be toxicities that can cause seizures, there can be hypoglycemic seizures. So there's a lot of different reasons that dogs can seize. And it can be, well, first of all, it's really upsetting when it happens because
Right.
it's scary.
Mhm.
So it happens fast and they go from looking normal to not normal, and it can be pretty startling. And so the first thing to realize is that you need to give, no matter what the cause of the seizure is, you can give glucose in some form and then seek veterinary care. So glucose can be ice cream, it can be honey, it can be maple syrup, it can be Karo syrup,
Carol syrup.
it can be caramels if they can chew. It can be almost anything that you can get into them. But the second thing you need to do is go to the veterinary clinic and not drive like a crazy person on your way there. And I've had lots of people that have gotten freaked out about it, and understandably. I mean, it's upsetting. I've had
Mhm.
my own dog have seizures, and it's even with knowing what I know about veterinary medicine, it's still upsetting.
Mhm.
So what you don't want to do is drive like a crazy person, regardless of the cause of the seizure, because you need to get the dog or cat to the veterinary clinic while you're all in one piece. Or, if you crack up the car on the way there, you're not
Not doing
you're not
anybody
helping the
any
pet.
good.
No, nobody.
Okay, so quick question and clarification maybe. When a dog is actively seizing, you're not trying to get glucose into them at that point, correct?
You actually can, and it
Really?
can be absorbed
Okay.
through their gums. So you don't have to get them to swallow it. Now, ice cream, they'd have to swallow, caramels, they'd have to swallow. But
Caro
if you
syrup
just have a
I've
liquid,
used.
Karo syrup,
Mhm.
honey, maple syrup,
Mhm.
um, dark Karo syrup, light Karo syrup, I don't
Mhm.
care. Any of those are fine, and they can absorb it right through their gums.
Mhm.
So you don't have to try to get them to swallow it. And if the dog is seizing or cat is seizing, do not pry their mouth open and try and pull out their tongue. I can guarantee you will get bitten, and it is not worth it because you're not going to save them. They're not going to choke on their tongue. So all those things that you've seen in all the movies, no, no. Just go get the Karo, put it on their gums, and then
As
calmly
long as
call the
they're not
veterinary clinic.
gnashing their teeth and you're not gonna get
Uh,
bitten.
Yeah, and don't let them bang their head against the coffee table leg 400 times. Move them in a place that's safe. They're not going to fall off the couch, fall down the stairs, any of those things. Call the veterinary clinic, find out where you can go. If it's after hours and you have to find an emergency clinic, call before you go because they don't all have capacity all the time. I've known many clinics around us that are now, if they have a caseload that overwhelms their staff, they just close, like close.
Wow.
So even if they're in the building, they may not be able to accommodate you. So call first, make arrangements,
Mhm.
and calmly and reasonably drive to the vet clinic, take your phone and drive. So be calm about it because if you're in an accident, you're not going to get there.
Yeah.
They say so.
And seizures are terrifying. I had a hypoglycemic seizure in an itty like, still nursing from a bottle 2 3 week old puppy.
Yeah,
Um and it's really hard. And so I understand it's scary. It really is
it is.
scary. But uh, talk us through some of the differentials that we're going to see that are specifically hypoglycemic type seizures,
Sure.
where we know that
So,
the glucose is going to help bring them around.
sure. So we can start with newborns because neonates, newborn puppies, even young puppies up until they're several months old, have limited glycogen stores in their liver, which means that they don't have the glucose that they can activate and get into their bloodstream and serve the functions of the brain and the heart and all those things when they're really young. They just don't have the ability to store those levels in their liver. So, especially toy breeds, the small breeds are more at risk of developing that. So, they should be eating regular small meals if they are fasting, if they're not eating, if they're vomiting, if any of those things are happening, you're more likely to have that kind of situation. So you should not have the puppies go for an extended period of time without meals.
Right.
And yes, you can give glucose to get them through that, but that's only in the short term. If you don't get protein and other
Mm-hmm.
complex carbohydrates into them, they're just going to cycle back. Their glucose is going to spike and then it's going to drop and then they're going to seize and then it's going to spike and then it's going to drop. So you want to do something with complex carbohydrates. So oatmeal cereal, baby rice cereal, some kind of a carbohydrate plus protein to help support them nutritionally so that you don't have this thing going on. So that's newborns. We can see hypoglycemic seizures in adult dogs, particularly if they've gotten into xylitol, because xylitol, although it's a sugarless gum and candy and it's good for our kids, it's not good for our dogs because it will drop their glucose levels to the point of having seizures and staggering and then progressing into seizures. Like it'll look very strange to you.
Mm.
And we've seen several cases of this. In that case, you want to feed a bunch of ice cream to them and then get them to the vet. And then we had one that had eaten a significant amount, and at a high level, it also causes liver damage. So
Mm.
the client had this 80-pound pit bull terrier type dog that was it was a rainy day,
Mm.
it was foggy out, and the dog was fogging up the windows of the car because it was going to the whole thing. And the emergency clinic said stop at every exit at the highway on your way up here because they're about 15 minutes apart, buy a cup of ice cream and continue to feed the dog ice cream until you get here so that you can keep their glucose levels up. So
Wow.
they kept pounding ice cream down the dog. In that case, the client called and so my dog is acting really strange, and she was walking through the house talking on her cell phone. I said, "Well, look around and see if you can find something the dog got into, some kind of a toxicity." And she's in the first room, in the second room. She gets to the third room. She goes, "I found it. It's a chewed up package." She sent her husband and her son with the dog to the vet clinic to see us. And she stopped at the store that they bought the product at and bought a new package so I could actually read it because the package was so chewed up. Trying
Oh,
to read the package would not have happened. So she was way ahead of me on that one. She was thinking ahead. She's like, "You
smart.
don't know what's in the package unless you can see it." So that dog did fine with supportive care at an emergency clinic with fluids and so forth to support his liver. We can see elderly dogs that can have pancreatic tumors,
Hmm.
and that is pretty serious. They can develop tumors of the pancreas. They are not common. We see one every 4 or 5 years. They're
Yeah.
not common,
Yeah.
but they happen, and it's pretty devastating because those are serious illnesses that the dogs have. And then we can see this during pregnancy. If the dog isn't getting adequate amounts of calories during the pregnancy, they can develop a pregnancy toxemia. They can have low calcium and or low glucose, and they can go into a seizure type of activity. Again, their glucose can drop. I've also seen this in dogs with Addison's disease, where
Mm.
they don't have adequate adrenal function. One of my own dogs woke us up one morning seizing and checked her glucose. It was 20 and she was Addisonian. So you can see a whole bunch of metabolic things that can
Mm.
cause this. So it may be anything from a young puppy that just didn't get to eat often enough to a serious metabolic condition to something that pregnancy toxemia, as soon as the pregnancy is completed, then the toxemia goes away because the pregnancy went away.
Hmm.
So there's a whole range of things that this can be. Now, there are people that have glucometers at home, and I'm not going to suggest that you practice veterinary medicine on your own, but if you have a glucometer and you know how to use it with the little test strips, the ones that you use for people that are diabetic, you can do a foot pad stick and you can check the glucose. You can just do a quick spot check before you start them on ice cream, caramels, Karo syrup, honey, maple syrup, whatever it may happen to be. Because once you've given those, then it negates the ability of the vet clinic to do any testing. So if you can come in with your results and say, well, I did it on the glucometer and it came back 43, then the veterinarian has something to work with. Now, glucometers inherently measure lower than they really are.
Mm-hmm.
So that's also something for you to be aware of, is that because we worry more about hypoglycemia in people that are diabetic
Right.
than hyperglycemia, they
Right.
inherently measure probably 10 to 20 nanograms per deciliter lower than they really are.
Mm.
But still, if you're 43, that's not normal, because 80 to 120 is normal for a dog or a cat. So that kind of gives you some ranges. If you get 140, it's not hypoglycemia.
Right.
So I'm, like I said, I'm not telling you to practice medicine, but if you happen to have a glucometer and you're of the inclination to say, well, let's just find out what
Let's
this is
just know.
before. Yeah, what the heck?
And I think this is actually kind of, and we didn't plan for this, so it's me
Oh,
throwing
we
Marty a
never planned.
curveball again. Never happens. Um, I think this is kind of an interesting springboard into the larger conversation about seizures in general,
Mhm.
right? So hypoglycemic seizures are of the least benign thing that causes a dog to have a seizure.
Well, it depends. I mean, it can be the most benign, it can be the least benign, depending on
I'm
if
sorry,
it's a
the most
long-term metabolic.
benign.
Yeah,
Sorry, I did that
yeah,
wrong. I did that backwards.
yeah,
They're the least scary of the things.
yeah.
Um,
Generally, yes, because it's manageable.
right, exactly. So talk to us about I mean, there's a huge stretch of things that are seizure inducing,
Mhm,
and that aren't epilepsy, right?
mhm.
So I would love to have you walk through that conversation that epilepsy is basically a seizure that you don't know why you're having it.
Right. So idiopathic epilepsy is, we can't figure out the cause, and it's
Mhm.
probably a genetic underlying problem. Commonly seen in poodles, doodles, golden retrievers, labs, typically 2 to 4 years of age for the onset. And then earlier on, it's probably something more like hypoglycemia. Later on, it's probably more like a space occupying lesion in the brain,
Right.
like a mass, like a tumor. Now, not all masses in the brain are malignant or cancerous. So again, I've had dogs that we've sent in for MRIs and they've come back, well, yeah, there's a space occupying lesion, but it's not going to do the dog in. So that's
Hmm.
okay. That's cool. We can see cardiac things. I had a dog years ago that came in that had a severe bradycardia. Her heart rate dropped super low, and it would drop down, and she would go into asystole flatline for about 45 seconds at a time, looked for all the world like she was having a seizure,
Wow.
because I had her hooked up to the EKG machine. She'd flatline for 45 seconds. She'd go, oh, I think I think my heart should start again. And so she'd sit up and her heart would start. She'd sit up. She'd be good for 5 or 10 minutes, and then she'd flatline again. So you
Wow.
can see all kinds of stuff. And all honest to God, I swore it was a seizure, but because it was hooked up to an EKG machine and I could see that it wasn't, I knew that it wasn't that. So just because you see a seizure doesn't mean your dog has epilepsy. So let's
Right.
just,
That's kind of
break
where I
through
was
that.
going with
Yeah.
this.
Yeah, there's a lot of things that can cause dogs to have seizures. It can be metabolic, it can be toxic, it can be cardiac, it can be electrocution. I mean, it can be a lot of things that can
Mhm.
happen. And so you need to get a diagnosis as best you can. Now, there's not an epilepsy test, although there is now a DNA test for Lafora's disease, which typically happens in 7-year-old dogs. But I think there's only one company that's currently running that. So, and there's
And
inclusion bodies in the liver, and
is that particular test for all breeds, or is that breed specific?
it's breed specific for right now, but you can
Okay.
probably stretch it a little bit if you have a breed that's at
Mhm.
that age category and you want to do a DNA test. It's not going to hurt anything. It just may say, well, we can't really verify if it's validated in this breed, but just because it
Mhm.
isn't validated in that breed yet doesn't mean that it may not be a year from now or 5 years from now. So there's some things that are out there that you
A
may want to
lot
talk
of
to your
work
veterinarian
being
about.
done on this exact, I mean,
Yes.
a ton. The
Yeah.
American Kennel Club's Canine Health Foundation.
Yeah.
sponsors research on this. There's just buckets and
Yes.
buckets and buckets of research out there on it.
Right, right. There's a lot of diseases that we'd like to know more about that we don't. There's all kinds of cancer, there's all these other things, and so we don't want to go down those rabbit holes. But DNA testing is advancing pretty quickly, and right now, that's the best I can tell you is we don't have a DNA test validated for all those breeds. We don't have an epilepsy test yet, but
Right.
I think it's coming. I mean, eventually, I think we'll have it. But if you have breeds that are at risk, or say the mother and the father of the dog, or the mother or the father of the dog had seizures, well, you probably have epilepsy. But you want to rule out basically epilepsy is a diagnosis of rule outs. So you do blood work and make sure that there's not. I've seen dogs with weird calciums, like really low calciums that can look like they're
Mm,
seizing. And they can have really weird calcium because they have a parathyroid tumor or because they have diarrhea so bad that their calcium's not
mm,
absorbed. I mean, there's all these metabolic diseases that can cause it. So if you have a dog with an epileptic or an epileptic type seizure, you want an EKG, you want a blood panel, you want a physical exam, and you try to do it as close to the time of the seizure as possible.
right.
Now, if your vet clinic is open and you call them and they say, come on in, great, go right in. Don't give glucose, don't do anything else, just go right in. If they say, I can't see you until a week from Tuesday, then you have to deal with what you have, and that's when you
Mm,
give glucose and some of these other things. So you have to kind of deal with what's available to you at the time. If it's one short seizure, the dog is not going to die from it. If the dog goes out of a seizure into one, out of one, into one, out of one, into one, the dog could end up in serious trouble.
right.
So at that point, you want to get them to a vet clinic. That's grand mal seizures. You want to get into a vet clinic. You want to take their temperature, and if they're getting too warm, you want to cool them because their body temperature can go over 107 with the seizure because of the muscle activity and all the things that are going on. So every one of these situations is a little bit different. If you
Mhm,
see one episode, that's reason for concern. If you see a pattern, then that's really reason for concern. But if you see grand mal, that's an emergency. So you have to kind of scale it. And every emergency clinic isn't able to see everybody all the time. So it's not like it was before COVID. If it's a short seizure and it doesn't recur, then you call your regular clinic. If it's back to back to back, or you've seen a pattern, then that's when we start to do things.
mm,
And I typically don't treat, and I don't want to get down too far, but I typically don't treat for epilepsy until the dog is having seizures more often than once a month, or the owner is just intolerant of any kind of seizure activity.
mm.
A lot of dogs can have a short seizure every 2 or 3 months. It's not normal, it's not good, but you can kind of live with it. The side effects of medication, the cost of medication may not make it worth it until you get to that point. So we're way off hypoglycemia. We
No,
probably should back up
no,
here.
I actually, I'm taking hypoglycemia and going a direction with it. So,
I'm good.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
just on seizures,
Yeah,
one that I think people may not even think about. I have a Chihuahua, long coat Chihuahua, 5 pounds. She was a client dog, and she was still being shown at the time. And one of my other client dogs thought maybe she was a squirrel and that
mm,
she needed to be dispatched. And he tried really hard, and
I bet.
she was fine. She was safe. She wasn't injured in the attack, except that he knocked her crate down and she hit her head, and
Yeah,
she has had seizures ever since. And
yeah,
we tried managing them with Valium, and
yeah,
so she's been on phenobarb. So,
yeah.
do you want to talk through some of those treatment options for either that what you were just talking about, the intermittent seizure that is not
Sure.
hypoglycemic, or long term?
Sure. So head trauma is certainly a cause.
Hmm.
And there was a really interesting story that I was told when I was at a conference, and I will just share that here, is the dogs that have the soft spot in their head, the open
The
fontanelle, like
open fontanelle.
Chihuahuas,
Hmm.
and other dogs that are kind of dome-headed, they can
Hmm.
have that soft spot. And there was a veterinarian that was seeing a client dog that had a history of seizures, and they were in the exam room with the owners, mother and dad, and a child. And the kid kept pulling on mom's sleeve saying, "Mommy, mommy." And the mother looks at and goes, "Just a minute, I'm talking to the doctor." "No, mommy, mommy." And she says, "I'm talking to the doctor." He goes, "Mommy, mommy." And she turns and she goes, "What?" And he says, "The seizures get a lot worse when I do this." So he was pushing on the little dog's brain through the fontanelle. So if your dog has an open fontanelle, be aware that they should wear a little helmet and not let the 4-year-old like poke at their brain. So be aware that head trauma does cause those things. And
Yes.
if your child has something important to say, you should listen to them because they're probably going to share important information. Don't shut it
Two
down
very
because
important items there.
you'd be surprised what kids can tell you when you just listen to the child because they're a wealth of information that's unfiltered. So just be aware.
And he doesn't think he's doing anything wrong. He's just,
No one told him. Yeah, it's like putting a rubber band around the dog's neck. No one had told it that that was a bad idea because they didn't know. So all those things are real life things that happen. Okay, so seizures. If the dog has intermittent seizures, you may not treat at all. If the dog has seizures that are difficult to control, you may talk to your veterinarian about sending home midazolam, which is similar to Valium diazepam,
Mhm.
and it can be given rectally. There's a little
Yep.
tube
That's
that you
what
can
we
put in
did.
the rectum, or you can do there's a little aerosolizer now that you can put
Mm.
on a syringe and mist it into the dog's nose. And so you can, at home, if your veterinarian is willing to send you this controlled substance and with a limitation on how you use it, you can give those drugs to a dog that has seizures that are difficult to control so that you don't end up at the emergency clinic every 2 weeks.
Mhm.
So that's one thing to talk about is midazolam with an aerosol or with a rectal approach. Most dogs are controlled pretty well with medications when they are on them long term. Phenobarb is the drug that we've had for ever and ever for 50 or more years. And it works pretty well on a lot of dogs, but it can be that some dogs need to be on such a high dose it can cause liver problems. So we're a little bit careful with it. And it's a lot better now to treat seizuring dogs than it used to be because we have better drugs than we used to.
Mm.
Primidone does not work in dogs. It lasts about an hour and a half as a half-life. So
Mm.
even though a lot of people may be familiar with that drug for human seizures, it
Mhm.
doesn't work well in dogs. For many years, we've used potassium bromide either alone or with other medications like phenobarb. Phenobarb has to be given twice a day, and if you miss a dose, the dog is at risk of having a rebound seizure that can be worse than if you never started the medication in the first place. So that and the liver problem is why we don't always use phenobarb as much as we used to. And it used to be really cheap, but now it's gotten to be a more expensive drug. Yeah, it's gone up in
I'm
price.
sorry. I am providing a sliver of a pill to a 5-pound dog, and her
Yeah,
prescription is, I don't know, almost $100
yeah,
for
yeah. It's gone up a
3
lot.
months. Yeah, it's
Yeah,
crazy.
it's gone up a lot. And it used to be almost dirt cheap. I mean, it was at one point very inexpensive, but it's changed. So we have phenobarb, we have potassium bromide. Potassium bromide lasts for a longer period in the dog's body. It can last for several days. So you only have to give it every 24 hours. And if you miss a dose, it gives you that cushion of the
Mhm.
dog's phenobarb level didn't do this, and then the dog had a seizure because along with the phenobarb, you've got bromide and it kind of
Mm.
levels everything out.
Mm.
Now, in people, they report headaches with potassium bromide, but we don't know if dogs have headaches because they can't tell us. But I have used a lot of potassium bromide over the years, and it comes as a liquid, it comes as a tablet or a chewable. Really nice drug as far as we're concerned. Again, it's a little bit expensive, but
Mm.
it's still a really good drug, and it can be a nice drug because layering drugs together can allow you to use lower doses of either one with
Mm.
fewer side effects. On
Mhm.
too much phenobarb and on too much bromide, the dog can look a little incoordinated, stumble, and
Mhm.
especially the first week or two if they're on medication, it can be a little bit wonky until they kind of adjust to it and their liver learns to metabolize the drug and they become accustomed to it. The other thing about potassium bromide is that when you do a blood panel on a dog, it shows up as chloride on the test. So when you do a blood sample that has electrolytes on it, it can make the dog look like its chloride level is so high that it's not compatible with life. And the lab may freak out, or the veterinarian may freak out and go, "What?" That's the bromide because the test can't tell the difference between bromide and chloride. They're electrolytes that are similar and they show up on the same test. As long as you know that, it's not alarming. The thing that we use a lot now that we never could before was Keppra. And Keppra became generic
Mhm.
a number of years ago, maybe 5, 6, 7 years ago.
Mm.
And it again has become much more affordable. It used to be like you had to mortgage your house for a month's worth of medication, but now it's become much more affordable. It comes as a liquid, it comes as a tablet, it comes as an extended release. In tablets and liquid, it has to be given 3 times a day. In the extended release capsules, it can be given twice a day. So that makes it a lot more practical for owners to give.
Yeah.
So depending on your lifestyle, your ability to give medication, the cooperative level of care that your dog needs, because some dogs are great at taking medications and other dogs are evil. It's a real game changer to have Keppra available to us. Cats almost never have seizures. So that's the
Interesting
good
side
news is
note.
we see very few seizures in cats.
Hmm.
They do happen from time to time, but they're not at all common. So I don't want to look like we're not talking about cats, but they just usually don't seize, not at the same likelihood of a dog. Like if for every 100 dogs we see seizing, we may see 2 cats. I mean, it's a much smaller number.
Fascinating.
So that kind of gives you a general background. So if a client comes in with a seizing dog, we'll have a conversation and say, how often has this happened? How long are the seizures lasting? How severe is this? What is the dog's age? What is the likelihood that it's
Mm.
epilepsy versus a metabolic disease versus a brain tumor or
Mhm.
some other space occupying lesion in the brain? And what are the things that we want to give you? I've had dogs come back with all kinds of different things. There's one breed in particular that I was criticized by another veterinary professional for allowing the client to use related dogs in the breeding program because she said to me, well, this dog comes from a line of dogs with epilepsy. And I said, well, I don't think this is epilepsy. And at postmortem, the dog had a gliomyoma in its brain, and it wasn't at all epilepsy. It was a space occupying mass. So there's so many things that can be in without, I mean, sometimes without an MRI, we don't know what it is. And I don't typically recommend MRIs for people if it's not going to change your treatment plan.
And
If you say to
they're
me,
really expensive. I
they
have a
are.
very good friend who's been through this with a dog of mine actually that I bred.
Mhm.
And it's really hard and it's
It is.
expensive and it's
It is.
devastating and you
And
know.
if you say to me, well, if my dog is a brain tumor, I'm taking him to surgery and taking it out, then I'm going to send you for an MRI.
Mm.
If you say to me, if there's a brain tumor there, I'm not going to surgery, then I'm going to say we're going to manage you the best we can
Mhm.
with medications. And that's a legitimate thing to do. But first you want a blood panel to make sure it's not the calcium, it's not the phosphorus levels, it's not some other weird electrolyte thing, it's not hypoglycemia. So that the dog is real. And if you see these episodes, you want to call the vet clinic and say, okay, I've come in, we've done regular blood work. If this dog has another episode, can I come right in if you're open? And so you want to make sure that the reception team says, yes, we know if the dog has another episode, we want you here within 15 minutes so we can draw a blood sample and see if the dog's glucose is low. Bada
Right.
bing, bada boom. You walk in the door, they draw the blood, boom, you're
So
good.
that's
And then you can
that's
nail the
actually kind of what I
diagnosis.
wanted to know. What's your 15 minutes is your window?
It's got to be pretty short. And I mean, if it's an hour, it's better than not at all. But it can be very difficult to make those things happen because if it happens at 2 in the morning and your regular clinic is not open, go
Yeah.
figure,
Right.
they might go home and sleep. Then you have to figure out, do you buy a glucometer? Does your vet clinic teach you how to use it? They do make vet test glucometers for dogs. So there's actually one on the market that you can buy from Amazon for like $50 and do your own glucose levels. So there's a lot of options, but you want to involve your veterinary clinic with what you're doing diagnostically and what you want to do treatment wise, because the treatments are so varied. You're not going to put a hypoglycemic dog on a seizure
Right.
medication and vice
Right.
versa.
Right. I think that's really good information and really valuable and kind of a big chunk of what I wanted to do with going through all these differentials is there's a different treatment and a different causation for each one of these different
Right.
differentials.
Right.
So,
And if it's xylitol, it's one and done. If
mhm,
it's hypoglycemia from some other cause, it's going to be an ongoing issue. If it's seizures, epilepsy, it's a different conversation. If it's cardiac, it's a different
right.
conversation. And it can be very difficult to tell those apart. So the second thing I want you to do besides call your vet clinic is grab your phone and get video of what's
Mhm,
happening.
mhm.
Because number one, it helps you to time how long the episode lasted. And number two, it gives your veterinarian additional information about what they saw. And some dogs will have pre-aura, just like people do.
Oh,
People will describe they hear a song playing, a certain song, or they hear hot dogs cooking, and that's their indication that the dog is, or they're going to have a seizure.
right.
And dogs probably do the same thing, because when my dog used to have seizures, she would go from do 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 around the house to whoop. She'd come over and just stick right to me, be like, "What
Mm,
is wrong? Oh, you're going to have a seizure." Okay.
mm,
So, they start to identify that there's something wrong, and they start to
mhm,
seek out
mm,
the person that they depend on to fix the
mm.
problem. So those are all bits of information that you want to collect. If your dog circles to the right before it happens, you want to tell your veterinarian these things. So identify anything you can. You have your cell phone in your pocket, folks. Pull it out, hit the
Use
video
it for
button,
good instead of
use it.
evil.
Exactly. So use it to record all the information that you can before, during, and after, how long it lasted. You can tell, because it seems when a seizure is happening, it seems like it takes it an hour to end, and it's probably like a minute and a half. So the timer on your video will help to identify how long it's going on for. It'll help your veterinarian to see, are there some clues here that I need to know about? Like, are there things that we can identify from the video that we can do and use to make a better diagnosis and a better treatment plan for you? And if the seizures are twice a year, probably not going to treat. If the seizures are twice a week, you probably should.
Yeah,
But everybody
yeah.
has their own tolerance level. I have some clients, if they see one seizure ever, they're going to freak out. And other clients are like, look, it's a seizure. He looks okay now. And then they're good.
Yeah.
We're all different.
Yeah, Puffball actually still, our Chihuahua still has occasionally little breakthrough ones. They're not really bad,
Mhm.
but they're like little,
Right.
we call them episodes. And
Yeah.
so every time she has an episode, she goes and sits in Kim's lap, and it's really interesting because light does trigger her. And so if she's bad, she wants to be covered up.
Mhm.
So that's kind of, yeah, yeah, they seek
They do.
comfort for
They do.
sure.
I want to just say metronidazole at too high a dose can cause seizures.
Funny you should say that. um, Let me tell you a story about that.
Okay.
Because
Here we
it's
go.
Auntie Laura's Medical Mystery Dog podcast, right? Isn't this how this goes? I had an Ibethan hound a number of years ago who had acquired some sort of anaerobic lung infection and was
Ooh.
very, very ill and was trying to die. And my veterinarian, we agreed on a pretty risky course we knew going in.
You had
And
two choices, right?
yeah, live or die. And so he was on a pretty hefty dose of metronidazole for a good long time. I don't remember now exactly how much or how long. And he had not yet started having seizures, but you could see like little twitches
Hmm.
starting.
Hmm.
And I was like, eh. And then when he had the first seizure, she's like, okay, well, time to take him off some metronidazole and hope he's healthy.
Yeah.
But
Yeah.
yes, that
And
is lived experience, 100% a thing.
right. And I've seen it happen. The dogs will start goose stepping and looking a little
Hmm.
weird, and then they can
Yes.
progress to a
Yeah.
seizure. And that's not unusual with metronidazole. So the toxic dose for metronidazole is 65 milligrams per kilogram. The therapeutic dose is 50 milligrams per kilogram. So it's a very small step up, only about a 10 to 12% increase to get from therapeutic to toxic. And I have had that
That's
happen.
interesting.
Yeah, it's a very narrow therapeutic index.
Hmm.
A lot of people now dose it at 10 to 25 milligrams per kilogram because of the toxicities. And it's most common in the MDR1 dogs, but not exclusively those. So I had a Samoyed that was on a long-term course of metronidazole administered by someone who wasn't really paying attention to what they were doing. And the dog started having some episodes, and I talked to the client. She was in Wisconsin, her dog was in Utah, and I talked to her late one night, and I said, okay, tomorrow morning when the sun comes up, have the curtains on the hotel room closed, because as soon as that dog sees light, it's going to seize. And it did. And you can shorten the toxicity of the metronidazole from 33 hours to 13 hours by giving Valium,
Yes,
diazepam.
we used Valium for
So
sure. Hmm.
right. So not only does it help seizures, but it actually shortens the toxicity period.
Hmm.
So if you should have a misfortune of overdosing, like the dog picked up
Hmm.
pills off the floor, or
Right.
you gave the wrong dose because you read the label wrong, you didn't see there was a decimal point. You thought it was 5 tablets, not 0.5 tablets. And so you gave 10 times a dose. These things are all real
Yep.
things that have happened in my
Yep.
practice where I've had people
Yep.
tell me these things,
It
or I've
happens.
had them happen. So just be aware that if that happens, that it could be metronidazole. And when you take the dog to the emergency clinic or the vet clinic, you happen to say, and by the way, she's been on metronidazole. Because I almost missed one night. It came in goose stepping and acting really weird. And we were
Mm,
just about ready to send the dog out the door. It wasn't one of our regular clients, so I didn't have their record and I didn't know the dog had been on metronidazole. And we're just about ready to send the dog out the door and say, by the way, has he been on any meds? Because he wasn't currently on the
mm,
metronidazole.
mm,
Oh yeah, we
mhm.
finished it yesterday. Okay, well, this is metronidazole. So
Yep.
make sure you give a complete history, because
Mm,
little pieces of things like, well, we finished it already, I thought it would be out of his system by now, may not be the case.
right.
So again, just, take your meds along. If you're going to the emergency clinic, like, bag them all up and take them with you so that you have the doses and the drugs and all the stuff with you. Don't go, well, I don't know. Here, maybe I have the invoice on my phone. No, you're going to make the vet crazy. Grab the meds and take them with you.
Um, yeah, I think that just knowing that the concept of how important it is to be thorough, right? When you talk to your
Mhm.
veterinarian, I was very fortunate when Keeper went down because I was able to get him to
Mhm.
my veterinarian who had been treating him and knew exactly
Right.
what the problem was, right?
Right.
And he was
Right.
fine. He lived, I don't even know, 8 more years.
Yeah.
He lived a
That's pretty darn
very
good.
long and healthy life, much longer than most Ibethan hounds live. He lived to be almost
Sure.
14, which is
Yeah.
unusual.
That is
Um,
great.
yeah.
But be complete, be concise, take
Hmm.
your records, take your
Hmm.
stuff, take your meds. Don't, you know, be good to your veterinary clinic. Make sure they have all the information they need. If you have electronic records, take them along, take your vaccination history, be complete, and don't expect that they just know everything. I've got
Right.
one patient that the client called this week, and there are 213 pages of records transferred to us. And we've been taking care of her for 2 years, but the history still goes back with 213 pages of medical records. So that's not something that the doctor that's never seen her before is just going to flip through and figure out what's going on. So, make notes, be concise, be polite, do all the things that
Right.
you can make this as good a relationship and as efficient as possible, under the fact that you are stressed. It's somebody that you don't know, they don't know you, and it's costing you money. Be cool about it, because you're not going to help anything by shrieking at the vet tech. I'm just going to say.
No, no. Speaking as someone who knows an awful lot of veterinarians and vet techs, that's never going to work.
No, no,
I hear the
shrieking does
stories
not improve.
almost every day. My friend comes home and says, "You won't believe what happened today," and
Yep.
it's just one of those things. But I think too, I think that folks either have an inflated idea of veterinarians, it's the doggy version of Dr. House, or they have a really derogatory opinion. And I think both of those things are wrong. Well, okay, you are Dr. House, but other than that, um,
Well, I met our advertising guy 2 weeks ago, and he said, okay, you're all veterinarians. There were 20 of us at this meeting. There are 20 veterinarians at this meeting. And he goes, please, I want to believe you are all James Harriet. Please do not burst my bubble. Please make me believe you are all James Harriet. And that's a pretty high standard to live up to, because that did happen in the 40s when the world was a different place. 90
world was
years
a
ago, it
different
was a different
place.
place. Yeah.
And so, just in case you were wondering, your podcast is going to give you some TV hit watching tips. The James Harriet show on PBS on Sunday nights is
Mm,
really delicious. If anyone has not twigged to that particular show, it is we watch it every week. It is just
yeah.
absolutely fantastic.
Yes. Yeah, so support public television so
Yes.
you can get your James Harriet mug or
Yes.
calendar or T-shirt or whatever they're sending this week,
100%.
video, the
100%.
whole collection,
But
because
do you
James Harriet
follow
is
the
truly,
show? The story is just really compelling. It's beautiful. Oh my gosh, the filmography is lush because of course it's set in England, and it's beautiful. It is just really
and
beautiful.
if you're a reader, read it. The
Yes.
short stories are awesome for kids and grandkids. The full books are amazing. I mean,
I
there's a
read them
reason.
all from the time I
Yeah,
was like every single one, not
yeah.
just the big what's the first one? I can't remember now, but I read them all. Whole
All
series.
creatures great and small.
Yes.
There's a reason that there was a whole big swell of people who
Mhm.
went to veterinary school in the
Yeah.
1970s and 80s. It was a
Yeah.
James Herriot moment.
I'm pretty
So,
sure that's why I wanted to be a veterinarian.
yeah. Well, I have a banner on my wall that says WWJHD, and my staff looks at it and goes, "What is that?"
Jesus, what
I'm
are we
like,
talking about?
what would James Herriot do? I'm saying that,
Mhm.
and like, so if they have a difficult moment making a decision, we
Right.
go out and look at the banner. WWJHD. What would James Herriot do?
There you
This
go.
is your guiding light. This is your direction
Yes.
for how would you handle this situation if you were James Herriot? Well, I don't even know who James Herriot is. They go, oh my God, go home and watch TV.
So then you have to educate them a little. So there you go. All creatures great and small. We aim to please. That's what we got for you today. Thank you, listeners, for sending your questions. If you, listenerland, have a question, drop me an email. Okay, go to the website martyandlaurashow.com. Click the send me an email button. We're happy to talk to you. We're happy to answer your very specific questions. We're going to try and do this at least once a month. If we can do it more
Oh, yeah.
often, we get more questions. The whole show can be listener driven. So you guys make that decision.
And it can be more complex than one sentence. So bring it on, man. We're gonna
We're
handle
gonna
it.
Dr. House it up over here.
Great. There's a lot of pressure.
I know what I will tell a story the next time we have a listener question. I will tell my story of when Marty found zebras when she heard horse footprints. It's my personal story. So, all right, guys, we'll see you next week. Next week, any minute now. Like before you know it. Thanks, guys. Have a great day, Marty.
Bye.
Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc., sound design and editing by Premium Audio Services.